Well, good afternoon, everyone, and welcome to the Greater Fort Lauderdale Alliance's Business Leadership Virtual Town Hall Meeting. It's our 7th Town Hall meeting in the last 7 weeks. I'm Juliette Rolak, Chair of the Greater Fort Lauderdale Alliance, and I'm pleased to be serving as your host this afternoon. Today, we wanted to again provide an update of the latest information available regarding business continuity and recovery during the COVID-19 crisis. We just learned yesterday from Governor DeSantis that although we are on track to get there, South Florida still has a few more challenges to overcome before getting to phase 1 of the state's reopening plan. There's still more to do. Our purpose is to share as many facts as we possibly can in our time together. And our goal is to provide answers to questions that are important to members of our business community. To everyone attending, thank you for what you continue to do for your community, your companies, and your employees, and for all the acts of kindness we've seen from so many people. I know even in our company, we have a program where our employees are donating monies to those who cannot afford to cover the cost of their electric bills. The generosity of our community is overwhelming. We have 5 great presenters today: our county mayor and experts in small business, health, tourism, and arts and culture. We will be taking questions throughout the meeting. If you have a question, please send it to us by way of the chat button at the bottom of your Zoom meeting screen, and we'll get to as many as we can. Again, just send us a chat and we'll take your questions there. And with that, let's get right into our meeting. First, I'm very pleased to call on our first speaker, Broward County Mayor Dale Holness, who is also a member of the Greater Fort Lauderdale Alliance Board. He has participated in more press conferences than I'm sure he ever contemplated, and is doing an incredible job helping lead our county's efforts during this difficult time. We are very fortunate to have him helping at the state level by serving on the executive committee of Governor DeSantis's Reopen Florida Task Force. Mayor Holness, we'd love to hear from you. Thank you.
Well, good afternoon to everyone. Thank you so much, Juliette, and to the leadership of the Alliance for the great work that's being done, and to all the community leaders who are participating in helping us face this pandemic as a united community. And we have actually been quite united. The mayors of Broward County and I had our last conference call together on Friday evening discussing the steps that we would take going forward. Just to give a quick update as to where we are, because it's something that I look at pretty much every day. We have tested 45,986 people in Broward County. 4,953 of those have tested positive, and 40,972 were negative. To break the numbers down a little bit, because that's something that I think we have to pay some attention to in terms of how does that break out for the community. We've heard a lot about the disparity that exists within our communities and how it affects minority communities and lower income communities more so. So of that test, 49% of the cases that were positive are white. The deaths amongst whites is at 48%. For Hispanics, the number is 24% in terms of the percentage of those who are positive. And it seems only 5%. I'm wondering if there's something wrong there, but that's what the numbers from the health department is showing, which is good news for the Hispanic community. In terms of the Black community, 34% of those tested are positive. And the death rate for Blacks is at 38%. Their hospital rate is at 46%. White hospitalization rate is at 42%, and Hispanic at 14%. Just give you a little sense as to how it breaks out demographically. And certainly with the work that the Alliance has been embarking on to create prosperity for all Broward County residents, which is something that I've spent a lot of my time in public office working towards. We now need to look to see how, as we go forward, we might be able to bring some balance to the picture that we see here in terms of the disparity of those who are affected by this pandemic in our community. Now, one of the things that we have to look forward to is how we build going forward. And we are discussing utilizing that penny tax that was passed to ensure that we're doing the infrastructure work. That's one area that we can work on. Continue to prepare for the construction of the convention center hotel and the expansion of the convention center, and continue to work at the airport and the seaport. I believe that that's one area we can actually put some dollars in early to rebuild the economy. And we're gonna have to work together to rebuild this economy because it's been devastated. I still get large numbers of calls for people who did not receive their unemployment check or did not receive any of the funds for small business loans that was out there. And as we work to rebuild, it is going to be essential that we work together as one united community to get our people back to work and to rebuild this economy. We can do it. We can get back to where we were and even surpass that if we're working together. So there's a lot of steps that we have to take, and I'm also going to be looking and listening to the leadership of our community, the business leadership, to help provide some input, and I've been getting quite a bit of that for us to move forward with our county administrator at the HEM, and she's done a fantastic job. I just commented earlier on a radio program that since we first found out about that one person at the port, Bertha Henry has not missed a day of work. That's 7 days per week. Probably only one Sunday she hadn't come into the office. So there's a lot of people in our community that are doing a tremendous amount of work. The United Way of Broward County has raised funds and distributed it. Many organizations have stepped up. Feed in South Florida has partnered with us to utilize our parks for food distribution. The community has responded in a positive way for us to work together to build a better future for all of us and as we fight this pandemic. Thank you.
Thank you so much, Mayor. You know, when at the beginning of your remarks, you gave us some metrics on the racial disparity and the impact of this COVID pandemic. And it is troubling, but it is so important for us to know so that we can continue to focus on ameliorating those indices. And I've seen that there has been a new and concentrated focus on doing that. So thanks for bringing that to our attention. And please, on behalf of the Alliance and all the businesses participating, do share with Bertha that we appreciate every hour of her 24/7 watch for us. Of course, we have some questions for you. One, at Monday's press conference where you discussed phase 1 of the reopening of the county, you spoke about some restrictions that would be placed on the facilities that were opening this week. Is there a plan in place, or how does the county hope to enforce some of the restrictions, such as people wearing masks from going in and so on, or going into community pools, or having one person in a golf cart? It's a tough job. What do you have in mind?
It is a tough job, but let me tell you what I have discovered since we've put these orders in place is that the community is actually helping us to police it. People are actually talking to their neighbors and to folks that they encounter at the grocery store. It says, you're not wearing a mask. You should be wearing a mask. The grocery stores and different places are requiring that people wear masks before being served. In fact, in our newest order, we had to do an exemption because someone filed a motion that they had religious reasons not to wear a mask. So we had to exempt that as one category. But that was only one person that we found that did that. Today, I got a text from someone at the golf course saying, you know, they are serving food at the counter and people are sitting at the bar chit-chatting, and they're not social distancing and they don't have masks on. So again, the community is actually working with us to make that happen. The sheriff's office has agreed to provide support for us. Many of the police departments are doing that. And for the most part, it will take a warning. Most people will comply, and I think we're seeing that. I don't believe that we have a major issue with people not complying.
Well, that's very heartening to hear that people are doing the right thing. So we have a burning question from one of our small business owners who are really being impacted here. Can you tell me whether the county has any estimate or view into the future about when that might happen, smaller businesses being able to
When we
reopen?
will open smaller businesses?
Yes.
We don't have a set date yet, but I can tell you, looking at the trend that we have seen, and I'll give you some numbers on that. Our highest number of positive cases in the last 14 days occurred on the 23rd of April, and that was with 218 people testing positive. The trend prior to that was downward with 104 on the 21st, 110 on the 22nd. But then when we look at the last few days, on the 26th, we had 54 positive cases, 51 on the 27th, 39 on the 28th, and 68 yesterday. So the trend is there. And when we have met 4 of the 5 requirements that the CDC and the federal government has set for us in terms of when we can go into phase 1 fully. And I think last time I might have told you what those were: a downward trajectory of COVID-19 syndromic systems that's been shown, downward trajectory of those with flu-like illness within a 14-day period. Both of those are 14-day period. A downward trajectory of positive tests as a percentage of total tests within a 14-day period. And our test rate is at about 10% compared test to positive cases. And the ability to treat all patients that would need help without going to a crisis mode. And the final one is robust testing for at-risk healthcare workers. We have not really fully got to that robust testing part, and that's something that we're working on. The governor is to get 100,000 test kits for antibodies. We've asked for 20,000 of those. We're also looking to see where else we can get those antibody testing, and we're talking to one of our local universities to join with us so we can go out and do scientific sampling within the community to know what's going on in terms of those who have been affected by this virus and have gotten over it. So the testing portion of it is what we're working on now. I believe that we're very close within a matter of short period of time, a couple of weeks maybe, that we can start looking to ease. But the data and the science has to support the decision that we make. And we have to have consensus also. So early next week, I'll do another conference call with the mayors, hear where they are, what they're thinking, what they're seeing, what they believe we ought to do. And then from that, we'll formulate what we do going forward.
Well, thank you for those hopeful words. I know we saw that Holiday Park just opened another testing site. So every testing site we see, we know it makes, I think they have capacity for 400 a day. So that's moving the needle and really positive.
So our capacity to test, trace, and isolate folks who might be positive is going to be an essential part of what we do to ensure that once we open, we don't get that surge.
Yes, we're all hoping for that. Thank you so much, Mayor. So now we move to our next speaker, who helps lead the U.S. Small Business Administration South Florida District, serving over 1.5 million small businesses. To give us insights on the SBA and its program is Janelle Hine, Deputy District Director of the SBA in South Florida. Janelle, we would love to hear what the SBA is doing. Are you there?
Sorry, I have a short slide presentation if that's okay.
Absolutely. Are you able to share it?
Yeah, I'm going to do that now.
Okay, thank you.
Okay, so yeah, I'm with the Small Business Administration. We've been having webinars and virtual office hours for the last 6 weeks to help people understand our programs and to get them educated on how to get ready to apply and what's the next steps. So our slide presentation kind of covers all of that. The first loan program is the one that we use as a standard response for disaster response. It's our economic injury disaster loan. We like to call it EIDL. Many people in the government use acronyms, so we're one and the same with that. This is, like I said, a program that we've had around for many years. We rolled it out a few years ago for Hurricane Irma, along with our physical damage disaster loan. We put this in place to help people to pay their monthly expenses, to help a business get by during situations when there's been a disaster that's been declared. The maximum loan amount is $2 million and the maximum term is 30 years. It is fixed rate funding, so there's no fluctuation in the interest rate for this particular program. However, not every business will qualify for the $2 million and not everybody will actually qualify for the 30-year term. We look at the needs of the business to determine how much they are eligible for and the financial strength of the business pre-COVID to determine whether or not they have repayment ability and at what level. The interest rate, like I said, is fixed. So it's 3.75% for for-profit businesses. It is open for private nonprofits also, and that interest rate is 2.75%. The first 12 months of the loan, there is no payments required. The borrower can pay if they wish, but we actually have a payment deferment for the first 12 months of the loan. The amount of the loan, as I said, can go up to $2 million. If you want one that would be considered unsecured, that would be at the $25,000 mark or lower. If we go above the $25,000 mark, then we would require business collateral. If there's not sufficient business collateral to secure the loan, then we'll look to the personal collateral of the owners of the business to secure the loan. The EIDL loan advance, that's the new port of this program that came about because of the CARES Act passing. It allowed eligible borrowers to advance up to $10,000. We calculated that at a rate of $1,000 per employee to give some immediate relief to businesses so that they would then wait for the regular loan to be processed and be able to have that type of money. There's a 9-month time frame to apply for this loan. So, and that's normal for this particular loan program. It's almost always open for 9 months. It may be extended, but it'll be extended by our Office of Disaster Assistance if they decide to do so. Currently, we haven't brought this particular loan application platform back up yet. We're trying to go through the PPP program first, and so I think that it will be open within the next couple days, but right now I don't have a time frame on that. Almost every business is eligible. You'll notice on this slide, there's more eligible than ineligible. We have been changing and shifting and modifying our programs throughout the time that the declaration has been available, and these slides reflect that. Initially, we didn't have people eligible that were agricultural enterprises. With the passing of the legislation last Friday, they are now eligible under EIDL program. The gambling organizations as well, as long as it's legal gambling organizations, obviously, but they initially were not eligible to apply. Now they have been deemed eligible. And when we're talking about private and nonprofit organizations, this slide outlines who might qualify for that. So again, it's different than our regular guaranteed loan programs where we only work with for-profit businesses. For a disaster declaration, we kind of widen the net so that we can capture the largest amount of businesses that may have been affected by a particular disaster. If you've already got an EIDL loan, I mentioned before that we had last opened it up for Hurricane Irma, you can still qualify for a loan under the program now. You can have more than one disaster loan out at one time. You can also apply for both of the programs that we have available right now, the EIDL loan and the Paycheck Protection Program, because that's a question that we're getting quite often from businesses, whether or not they can be eligible for both. If by chance you are denied for the loan, we give you a window of opportunity of up to 6 months to come back to the SBA and ask us to reconsider that decision and possibly submit some additional documents to support the decision. How you apply. Again, the disaster portal right now isn't currently open, but we're hoping it will be in the next couple of days. So I've provided the link on where people can apply online. We also have a phone number and an email account for our Disaster Customer Service Center. Victoria Guerrero, my district director, who was going to be doing this program, and myself we're considered regular SBA employees. We work at our Miami office, and we typically are talking mostly about our regular programs. During when we have a disaster declaration, we kind of shift and change, and then most of our messaging becomes disaster related. But we don't have access to the disaster programs, not to see where people are in the loan queue, not to find out the status on their applications. They have to work through our customer service center to get that information, which is why we provide the information. However, we know that some people may have need assistance in applying for the different programs. Our resource partner network, which many of you I know on this line are aware of, can help with either helping them fill out loan application forms. It could be that they're going to have to generate some financial reports like a balance sheet or a profit and loss statement. These partners can help them with that, but they do more than that, obviously. In good times and in bad times, our resource partner is kind of the counseling and consulting arm that we use to help small businesses in our community. I've provided the link at the bottom of the slide. If you put in your zip code, you can find the local resource partner that's listed nearest to you. This is our active program right now, the Paycheck Protection Program. I like to call it the Triple P, but it's the one that we just received a second round of funding for. So this program is to assist businesses in helping them to get salaries back into the hands of their workers. It was a way to incentivize businesses to bring workers back or just to make sure that they could pay them so that they would not necessarily have to go onto the unemployment rolls. It's averaged, the loan is calculated by using the average monthly payroll costs for last year. We multiply that by 2.5 times. The maximum cap is $2 million. In our first round of funding, I will tell you the majority of the funding, the loans were under $150,000. But I know that some people were getting some of the maximum numbers. This loan is attractive to our borrowers because there's a portion that's forgivable, which is again different than our regular program. The business owner, during an 8-week period after they get their disbursement, they have to maintain not only their salary expenses, but also the full-time head count, and then they can qualify for forgiveness for this particular loan. The use of the funds, again, primarily the use is for salary expenses. During that 8-week period, we want them to expend at least 75% of the funds that they receive for their payroll expenses. The other parts can be used for mortgage interest, rent payments, and utilities. It's any amount that is not forgiven or any amounts that are not used for the regular appropriate loan proceed uses would be then a loan that is for a full 2 years at an interest rate of 1%. With this loan, again, the first 6 months, there are no payments required. It's a payment deferral for 6 months. And again, different than our EIDL loan, no amount of this loan, no matter how big amount you get or how little amount, requires any additional collateral and no personal guarantees by the owner. However, we have a deadline for the amount of time that we can have this program open for businesses to apply for, and that's at June 30th or as there is funding available. So, we know that the first round went through in about 12 days. We were done with the initial funding of $349 billion. We have another $310 billion this time. We have changed it a little bit. There is a portion of the amount that's actually carved out for smaller lenders now. So hopefully that's a way that we can get money into the hands of the small businesses in a better way. It has to be done through a lender. This is not a direct application to the SBA. So you have to utilize one of our lenders. So I've provided a link at the bottom that tells you how to find a lender in your area. There are other lenders that have been approved that are non-depository lenders, companies such as our fintech companies. So Square, Intuit, PayPal, Bluevine, and Cabbage. Those are all entities that have been approved to take applications with this program as well. But we do know that during the time that we didn't have funding, many of our lenders were just beefing up their loan queue. How much you can apply for, it depends on how you are actually organized as a business. Again, we're looking at your average monthly salary costs times a multiplier of 2.5. You need to cap all employees at 100,000. If you pay someone more than 100,000, you can only qualify for the first $100,000 that you're paying them. But some of the items that are listed on the screen are what will be required from you to show to the lender so that we can determine what that amount of loan is. There's actually a very good link that's actually on the bottom of this slide out on the Treasury website that lists how to calculate your loan amount. It covers each of the different scenarios depending on whether or not you're a corporation, an LLC, a sole proprietor, or an independent contractor. But what you can't include is payments to independent contractors, those 1099 employees. And if you are an S Corp or a C Corp owner, if you're not actually providing yourself a salary, then you cannot count shareholder distributions or withdrawals. Those don't qualify under this program either as salary. We do have two additional programs I wanted to mention at the SBA Debt Relief Program. Currently, if you have an SBA loan in our regular side of operations, that would be for the 7A, the 504, or the microloan program, we will make payments for a period of up to 6 months. Additionally, if you book a new loan between now and September 27th, we'll also make those first 6-month payments on those loans as well. We do have an Express Bridge Loan Program, and that is available through our Express lenders as long as you have a business relationship with them. Again, another way to access up to $25,000 with a little less paperwork than a regular loan so that you can get some money in hand to help the business out. This particular loan, the Express Bridge Loan Program, can be paid off if you actually are qualified for the EIDL going forward. I've included a couple of other sites on this slide on how to get a hold of us or to stay connected with us. We have our regular website. I mentioned we're doing the webinars and the virtual office hours. Those are ongoing and continuing and will be throughout the time that we have this, this particular situation. So you can find those times and how to join on our website. For our Twitter account, obviously we're also pushing information out through that. We're using our YouTube account, and we still have our district office mail, the email address. This is a list of all of our employees. So we wanted to make sure you had faces to the people that you're actually discussing with. So, but thank you for letting us join.
Thank you so much, Janelle, and to your entire team. I know you have a tireless job at the moment, and we all appreciate it. The information you provided was extremely helpful. And this will be posted in the video, so you will be able to, everyone participating will be able to review the information provided. I'd like to invite you to send questions to Janelle while we are on the program through chat. I know she's been gracious to answer some questions already, so thank you for that so much. Our next speaker will provide the critically important health report and hospital update, something also of interest to everyone. I have to give him a shout out as FPL needed Broward Health's assistance, and when I called him in the middle of all of this, he immediately stepped up and got it done for us. That's the type of partnership that reflects so well in Broward. We're very pleased he could be with us here today, and I'd like to welcome the president and CEO of one of the largest public health systems in our country, Broward Health, Gino Santorio. Gino?
Thank you so much, Julia. And I echo the community partnership that's been going through South Florida and Broward County. It's really been great. I'll try to give a brief presentation in the form of an update and then leave time for some questions. So I'll touch a little bit on access to care to start with. So I have been working with the businesses and the local municipalities, Mayor Holness there. I see I've worked closely with him. In addition to the National Guard sites, Broward Health has opened 2 mobile testing sites on our own, and we were able to put those in low-income areas that are disproportionate in terms of their health needs. So one is in Pompano Beach, one is in Central Broward. We've done over 3,000 tests so far. We've also established a Nurse Connect free service, which is 24/7. We've been able to field some clinical questions through that avenue, roughly 10,000 calls so far. And then we launched a Be Healthy Now virtual app. Some of the systems have something very similar. It allows us to do telehealth, both if you don't have a provider, as well as if one of your providers are within Broward Health, we extended that platform to them. We're doing blood and platelet drives. A lot of times we hear the blood drives as being a big thing during the hurricanes. It's actually even more needed now because people are terrified to go to donate blood. So those have been very successful so far. And very much needed. For the innovative treatments, I think this is probably going to gain most of the interest. We have been fortunate enough to be able to get some of the rapid testing. So there's different levels of tests. You know, you've heard the antibodies. We have in hospital what's called PCR testing that looks for the antigen. That's also what DOH uses. We've been able to get rapid testing of the antigen to the tune of about 2,000 per week. We have them on 3 different platforms. So we're fortunate enough to have a wide variety of platforms to run these tests. And that's really helped us to be able to not only test our employees and the patients, but really to cohort the individuals who really are positive from the ones who are not. So that's been a huge thing for us. Our pharmacy team and intensivist group, so 50% of the hospitals in America have a 24/7 intensivist group, which is physicians in the ICU 24/7. A couple of years ago, we instituted that, so we were fortunate to be able to have that. And in conjunction with them, while this was still international, we started signing up for some clinical trials. We have an institutional review board that allows us to do that. So we're currently participating in 10 different clinical trials on how to handle this novel virus. What we have right now for patients that come in and are admitted to the hospital is what we call the COVID cocktail. I know it's not very scientific, but it gets the point across. And we're utilizing a variety of different antivirals and anti-inflammatory drugs to do this. So we have your standard hydroxychloroquine, which you've heard of, as well as the Z-Paks, right? So we started those. We've also added ivermectin, which I think you saw one of our physicians on the roundtable, remdesivir, Acterma, and then plasma and antibodies. So those are the ones that can answer specific questions if people have them more about that. But that has allowed us to have a significant improvement in the mortality rates of COVID positive patients, particularly the ones that are declining and heading towards being event dependent or already on event. We're really happy to report that 75% of our patients that are COVID positive have actually been discharged home. And you know, we're seeing an improvement in that number every day as we improve in some of the groundbreaking treatments. For caring for our caregivers, just so that you know what we're doing for the employees as well as the physicians and our partners in terms of physician groups, we've done a variety of different things. We have allowed people to use personal leave to flex down, because as you know, volume across the county is way down. Our ER is at 50% normal capacity. Inpatient, we're roughly about 60%, so it's significantly down. We have basically loaned 160 hours of PL time to our employees so that they don't have to go without pay. We added an emergency shift bonus for all the clinical positions. Our senior leadership, myself and several others, took a voluntary 20% pay cut to be able to fund a employee relief fund. And a lot of individuals came on board from leadership to also do that. It was nice because it was on a voluntary basis. We've contributed almost $200,000 so far to that relief fund for the individuals that, while we're not cutting any pay, a lot of people, their spouses may be out of a job currently. So we're trying to not contribute to the fiscal cliff as we've seen in Broward County is pretty good for that, but statewide that's an issue. As you know, many people are one paycheck away from poverty. So that's been a big push for us. We've adopted a universal masking protocol, been very fortunate in our ability to procure personal protective equipment. So we're able to give those to all of our employees, our physicians, as well as any visitors that come in, including all the patients. We give them one when they get admitted. Pop-up stores we've done in our hospital for the employees to purchase essentials. We've done rent abatement for our physicians. We haven't cut any stipends for our big physician groups, even though the revenues are down. And we are holding our providers harmless for base salary standards. As you know, a lot of the physicians over the last 10 years have converted from a flat base salary to a productivity, so that can become very problematic in a time like this. We've been able to keep them consistent for now. Insofar as technology, we have built 2 things that I'll talk about besides the telemedicine. One is our IT team has done something very novel. They've been able to create a dashboard that virtually tracks every single patient in our system, where they're at, whether they're positive or negative, and we can start tracking trends and share that with the state. That's been very useful for us to manage this crisis, and it continues to be useful as we start to add things onto it. We also built early on something of a predictive analytics model in conjunction with a group called Hospital IQ. They're the leading partner with teletracking, and that's been able to help us track where the plateau was. That's why we in the state were working with them on the same type of platforms. They sort of matched once we got a lot of data, and we realized that the plateau really had already passed. So our goal now, obviously, as everyone's goal, is to make sure we don't get a second wave. So that leads us to us being able to open for elective surgeries on May 4th. We're very happy about that. We have enough supplies and enough testing to be able to implement the enhanced protocols to ensure safety for the patients as well as the staff as we bring them in for elective procedures. Just so that you guys know how we're doing that, we're utilizing the AMA and CMS endorsed models, which basically creates a scoring algorithm. So for example, an elective plastic surgery procedure may not score the highest, right? We may have an elective procedure in terms of a biopsy for something that we're trying to figure out, is it benign or malignant? That's going to score a little bit higher. And that's all relative based on capacity. So we're starting our scheduling right now to start on May 4th. We have quite a backlog. So there's a lot of people looking to come in and get those needed surgeries. And we feel very comfortable that we'll be able to protect them. We've instituted a protocol to test ahead of time, no more than 48 hours out, to ensure that they're not positive and bringing additional contributing virus spread to the hospital. And we think that'll be successful. So moving forward, we'll continue the communication. I think that communicating with the partners, and I want to thank you for being able to speak to you all a little bit and answer some of the questions you may have so that we can make sure we're all on the same page. A lot of people have suggested some really useful recommendations that we've actually implemented. So I think the communication back and forth is very, very useful. But we'll also be encouraging our partners to continue to educate patients that, you know, just because we have this COVID pandemic going on, that does not supersede the need for medical care. If you're having a stroke or if you're having heart conditions, people really need to continue to call 911. We did an entire marketing campaign around that because we were seeing an increase in people, unfortunately, succumbing to a disease that otherwise could have been, you know, corrected had they come to the hospital. So, and that's a national issue. So we're really hoping to improve that. But I'll leave the majority of the time for any questions that people may have.
Thank you so much, Gina. It sounds like Broward Health is doing all the right things. Great to hear about the rapid testing, the clinical trials, and ramping up on telehealth, which people have seemed to really, you know, get accustomed to quite quickly. We appreciate all that you're doing. What is your perspective on contact tracing, at least our capacity to do so in Broward at this time?
So that is really DOH has been running that in terms of the epidemiological studies. And so what we do is we've been working in conjunction with them to make sure they have every piece of information they need. One of the things we're working on now in conjunction with DOH and ACA is making sure that we're doing some tracing specifically to the nursing homes and post-acute discharge locations. So what we're doing is we've created different testing protocols. So we will test them to make sure they have 2 negative tests for many of these locations before we send them to those locations. We've also had our infectious disease teams work with the strike teams that are going into the nursing homes to make sure that the protocols are consistent everywhere. And I've reached out to several of the post-acute centers and nursing homes in the last couple of weeks to put them in touch with some of the antibody testing in addition to any PCR testing that we can do. Now that antibody testing is starting to come out, there's been studies, there's a Harvard study that shows which ones are a little bit better than the other ones. And so we're able to actually provide the vendors that have a higher level of efficacy, and then allowing the state and ACA to provide some protocols on how they may be able to get the most utility out of a test like that.
Well, thank you so much. You've mentioned that you've gotten some useful advice. Here's one from one of our participants. Name for your COVID cocktail, the Quarantini.
I love it.
All right. So with that, we'll move on to another industry that's very important to our economy, and that is the tourism and hospitality industry. And it's one that we all want to see come back strong and hopefully soon. This time, I'd like to invite Greater Fort Lauderdale Convention and Visitor Bureau's Stacy Ritter, President and CEO, to share with us. Stacy, what's going on in your world?
Thanks, Juliet. If I could, I would use a 4-letter word about what's going on in my environment right now, but I'm going to keep this PG rated at the least. And also, I've determined that the next normal for Stacy Ritter is to tone down on the F word a little bit. So I won't be using that today. But that's pretty much where we are. Unfortunately, it has, in all seriousness, just been like dropping off a cliff. One day everything was fine, and the next day the world turned upside down. Unfortunately, in March, we just got the TDT revenue numbers for March, and we were down 58% over this time last year. April's going to be worse because April's been a much tougher month for tourism than March was. But we've decided that focusing on the future is where we need to be now. We understand where we are in the midst of the crisis, but how we come out of it and how we plan for and are successful in a recovery are really where we are right now. So just to let everybody know, on Thursday, May 7th at 10 a.m., we're going to have a summit called Focus on the Future, where we're going to be detailing our recovery plan and how we're going to move this destination forward and be even bigger and better when we are able to. In the meantime, what we've been doing is a lot of social media. We've pulled back on our paid marketing and our paid advertising, and almost all of our marketing and promotion now has been organic, in-house. We focused on social. As I said, we've done some pretty, I think some pretty interesting and creative social media campaigns. We've done our Eat Local social media campaign. I hope many of you have seen that on the Visit Lauderdale social media platforms. We've had 225 restaurants sign up to be part of that. That promotes those restaurants that are doing delivery and takeout. We just started this past Friday at 3:30 on Instagram Live, your favorite mixologist mixing a drink. I'm sure nobody has turned to alcohol during this particular event. You have your favorite mixologist will show you a brand new drink, not all titled the Quarantini, at 3:30 on Fridays. And we've been doing some Lauderdale interactive quizzes. And I hope that if you sign up on Visit Lauderdale and take a look, you can take some of those quizzes, which asks you questions about what your favorite things are to do, whether you like a small resort or a large resort. What's your favorite outdoor activity in Greater Fort Lauderdale? We've had more than 50 attractions sign up to be part of our virtual experiences. And we've had more than 35 people nominated via our Home is Where the Heroes Are campaign. We started a campaign in Broward County to highlight our local heroes, first responders, teachers, parents who are home with children. And we've had over 35 nominations for that. And we have had 6 where we have been approved to put them out on the web. Our social media presence has increased dramatically as well. In April, we had more than 3,000 new followers on Facebook. In the month of March, we only had 69 new followers, and that was all unpaid, no paid ads on Facebook. So we've done tremendous work in our social media engagement, and that will only help us when we come out of this. We recognize that safety is the #1 concern for the traveler in the future, and safety is defined differently than it was 60 days ago. 60 days ago, if you had asked people what safety meant to them, they would have said they want to feel safe walking on the beach at night. Today, that is a completely different definition, and we are working very closely with the private sector, hotels, restaurants, and retail to make sure that there are appropriate sanitary protocols in place so that when we are ready to open up, we can tell our visitors, yes, this is a safe and sanitary place. You can feel comfortable bringing your family here. We are a family destination. Most of us know that. But we've been having some internal conversations about what exactly that means going forward when we do start, and we anticipate a June 1st startup to do some advertising, some paid advertising, marketing, and promoting the destination. As I said, we know we're a family destination, and we anticipate that there will be a pent-up demand for multi-generational travel when we are all through with this. Grandparents will want to reunite with their grandchildren. Parents will want to reunite with their parents. I haven't seen my mom in 6 weeks. She's in an assisted living facility. So, getting together is going to be a big thing. But we also know that there are going to be parents who are going to want to dump the kids with the grandparents and get away on romantic weekends as well. And we've been having some conversations. Thank you, Bob. Bob at least is laughing. And we've been having some conversations internally on how we put that mix together and make sure that we have the appropriate amount of funding so that we can cover both bases, because we believe that both of them will actually be a real draw for us. The fact that we're not a dense destination, density is not an issue here in Greater Fort Lauderdale is a big deal. We're going to be putting up lots of pictures of big empty stretches of beach, Las Olas Boulevard with people strolling too closely, because again, we know that that is going to be number one on the visitors' minds. But when we come back is a question. We're focusing on the drive market right now. We think people will get in their cars when the all clear happens. And for us, the drive market can be as far as Canada, because we know Canadians will get in the car and they'll drive 3 days to stay here for 4 to 6 weeks. So that helps too. Our drive market is a lot larger than many others. When airlift comes back is a question. A lot of flights have been canceled. So reaching out to visitors who may be coming from farther away is probably a little farther down. We stopped funding all big events throughout the rest of this fiscal year. We don't think people are going to be comfortable in groups of 1, 2, $5,000 people through the remainder of this fiscal year. And clearly budgeting is an issue for us. With TDT down significantly, the CVB is over 99% funded tax revenue. And unlike private CVBs, we don't raise a whole lot of money on the private sector side. So we know that that's going to be an issue going forward. Many of our colleagues in other destination management organizations have cut their staff. Dallas has cut their staff by a third. San Francisco, 75% of their employees are no longer working at Visit San Francisco. So budgeting is going to be a big issue for us, not just for this remainder of this fiscal year, but for the next fiscal year as well. But we do believe that we have an exceptional place to come visit. We know we have an exceptional place to live. And we think that we're going to have an easier time than some other destinations will, which are more dense, have more people, and aren't as spread out. Sunshine 300 days a year and an average median temperature of 80 degrees. You just can't beat it.
Thank you so much, Stacy. I wanted to take a moment to say that we're all sorry to hear about the loss of your Al Tucker, who did such a tremendous job for us in our multicultural tourism. And I know that was a loss for you, but we really appreciate all that the CVB has been doing to keep the Greater Fort Lauderdale region alive and well, and at least still relevant, right? So you've been doing a lot with virtual vacation experiences and asking these surveys. Can you tell us a little bit about how the CVB is supporting or planning to support local hotels with staycations and so forth?
Well, we of course are, as I said, tourist development tax. By the way, thank you for that nod to Albert. We've had 2 losses at CVB this year. Justin Flippin passed away in January, and Albert passed away a couple of weeks ago. And it's been a very difficult time. Some of us are teleworking, and we haven't seen each other for a while too. We did do a Zoom staff meeting today. It was the first time we were able to see everybody in a month, and that helped, but it has been very, very difficult. So thank you for that. We are TDT driven, and the statute is very, very careful about how you can use that money, 125.0104. So we have to make sure that when we do expend funds, the primary purpose is to promote the destination for visitors, which means people outside of the county. If you're coming from Weston to Fort Lauderdale, you're not counted as a visitor, even if you're staying in a hotel. And so we are very careful about how we spend the money as a result. But clearly promoting our local hotels, our local restaurants, our retail and attraction to people outside of the county, which is what we do on a regular basis anyway, will help move that needle forward when we can open up. We're working very closely with the hotels, specifically now on sanitary protocols and what we think will sell versus what they think that they're doing. I mean, Hilton, for example, is partnering with Lysol. The Marriott has a task force made up of infectious disease experts as well as others to tell us what we need to do to make sure people feel safe, comfortable, and clean when they're here. The Wyndham Deerfield Beach put out a 4-minute video detailing what they're doing. Housekeepers are wiping down the clocks, the phones, and the door handles. The bell people are wiping down the luggage carts. Everyone is wearing a mask and gloves. And while we think that that's where it is today, we're hoping that as we move forward, it's very, very hard to be welcoming when you're wearing a mask and gloves, or to make people feel that they're wearing a mask and gloves. But we're working very, very closely with the private sector to put together necessary protocols, again, across all spectrums of the private sector to make sure that when we are ready to open the doors, we have everything put in place, because the last thing we want is to say, yes, we're ready, and not actually be ready.
I understand. Like you mentioned, with the difficulty, welcoming people with masks. I miss seeing smiles, even frowns I miss seeing now. At any rate, thank you for that. So, you've spoken about the highlights of our Greater Fort Lauderdale region, and I think it's appropriate now to segue into one of our highlights, the Broward Center for the Performing Arts, which is led by President CEO Kelly Shanley. Kelly, arts and culture severely impacted during this time in our economy. Could you share with us how you've kept things going and how it is in fact impacting your industry?
Thanks, Juliet. And thank you for all that you and Bob and everyone at the Alliance are doing to keep everyone in this community connected and informed. These calls have been great. I know not just for me, but it's evidenced by the number of people that show up for them. So thanks for all you guys are doing. And you're right. I mean, I would echo Stacy's comments. I might have even echoed her uncensored comment about the status of things. It has been devastating. And if you look at arts and culture as an industry, and that's the best way to talk about it in this context, because it's been affected as a business the way that many other businesses have been affected. On a scale, it's a $400 million a year industry right here in Broward County, with 11,000 jobs being affected by what's going on right now. When you add in commercial live entertainment, it quickly gets up to $1.5 to $2 billion a year and almost 30,000 jobs. So there's a lot that has been affected by all this. And as you can imagine, all of that has gone to absolute zero in terms of live entertainment, mass gatherings, people gathering together. I mean, you could quickly realize that that's the thing that needs to shut down first. So, and it's also an important economic driver for everything that Stacy was talking about. 63% of tourists coming to Broward County indicated that arts, culture, or live entertainment was a primary purpose for their visit. So all these things are really interconnected. And as we look at restarting the economy, we've got to look at it holistically and figure out how we can bring everything along to contribute to economic recovery. When we want to zero in on arts, culture, particularly live entertainment and performing arts that we're involved with here at the center, the Broward Center being an example, we've estimated a loss of $10 million in revenue through the end of this fiscal year. 85% of the staff here at the Broward Center is laid off, and the rest who are on board have had a pay cut or a reduction in hours. So we've tried to get ourselves as lean as possible, but you can imagine how painful that is for everyone who's involved, and all arts organizations are in the same boat. So arts organizations have a combination of earned income from the things that they do and contributed income on the other side. And the nonprofit arts organizations that rely on contributed income a little bit more than we do have also been affected, because usually the way that they raise the most money is by gathering people together for some sort of event, and all those events have been canceled. So, so the arts and culture sector, live entertainment, is not in a great place right now. And the thing to remember about them as a sector of our economy is that they were the first ones out and they'll be the last ones in, and rightfully so. When we think about the safety of our community, it was a difficult thing for us to realize that the exact business that we're in of bringing people together was exactly what our community needed us not to do right now. And that's probably going to go on for a while. I think that we'll be the last in line. I don't think anybody could predict exactly when it's going to make sense to allow live entertainment and sporting events and things like that to begin again. But we know it's not going to be anywhere in the near future. And so we've got a longer period of time that we need to account for the shutdown being without revenue. And just like all business sectors, arts organizations may not survive that shutdown period. Everybody's not going to pop out on the other side and be ready to go. We're going to see restaurants who don't make it. We're going to see arts organizations who don't make it. So how we re-enter the marketplace, help the economy, and play a role in the recovery is going to be a very tricky one. And the other thing for people to understand, and that people don't think about a lot, is in the performing arts industry, there's a lot of risk in presenting shows, even when the economy's good, even when all the conditions are good. So when arts organizations emerge on the other side, they're going to be in an economy that's in recession. They're going to face conditions where people still may have lingering fears about attending mass gatherings. And that makes the economics of everything we do all that much more challenging. But what we're doing is every day looking to position our own organization well, and also work with everyone in our industry to find the resources to bring to bear to make sure that the arts and culture sector is prepared to come out when the community's ready for us and make an impact on the economy. The uncertainty, though, about what we're going through right now is having an effect that is sort of beyond our control. So even at the point where local authorities or the state or whoever it is feels like it's okay for venues like ours to open here in Broward County and across the country, we're going to need a lot of lead time as it relates to touring attractions. So concerts that are touring, Broadway shows that are touring, are looking at the uncertainty of the next 6 to 9 months and beginning to shift themselves out into the winter and the spring. So even if we could open in the fall, there may be a dearth of product out there for us to put on our stages. So in this interim period, we're also getting focused on local talent, other things we can do like performing out in parks, performing on a smaller scale, doing things that the community is going to be thirsting for, but doing it without potentially some of the touring acts that we normally have. The concert industry is a little more nimble. I think we'll be able to see musical acts coming in as soon as we're ready to go. Theater may take a little bit more time to get rolling again once we're allowed to reopen. And again, that's going to take into account the entire country. One of the things we do know, though, is that creating a clean and safe environment here at the center is going to be critical under any condition that we reopen. And so we've teamed up with Cleveland Clinic. They're a sponsor here at the Broward Center, and they're giving us some great guidance and support as we try to figure out what are all the standards and protocols that we need to put into place to create a clean and safe environment so that people can confidently come back out and enjoy theater. So we're excited about that. And what I would say is, well, our primary purpose is bringing people together, and it's best that we don't do that right now. There are many things that we can do to actively engage our community in a meaningful way. We're a mission-driven organization. We have known forever that we are here to serve this community and help it achieve its goals through the arts. So the goals are all a little bit different now, right? And the situation is different. But our staff has been creatively focused on how we can still deliver on our mission under conditions like this. So one of the ways we're doing that is, right away, we got a call from our partner at Broward County Schools as they shifted their entire student body onto virtual learning. They were looking for resources to help create curriculum and activities that could be delivered virtually. And of course, we've been their partner for years in creating and delivering arts education curriculum. And so our team got together right away, and we are now providing those types of programs to Broward County schools so they can create a more engaged learning environment online for their students, and also have specifically arts-based programming that students can learn from while they're in their homes and learning online. And all of our education programs have quickly moved to online platforms. We're developing them as we go. As we move into summer camp season, we're prepared to go either direction, whether we can have a camp physically here on site, or if we have to move that to a virtual environment, we're preparing for either one of those directions. And one of the things that's still happening right now is we are proceeding with our renovations at Parker Playhouse. And actually, I can share a photograph of Parker Playhouse in its current form. So what you see here in this photo is the Parker Playhouse and the new lobby that we're putting on the front of the building. The glass is going into place. That'll all be closed up here in the near future. And our construction team is continuing to work on Parker Playhouse, set to be finished with the construction on the Playhouse in December, so that we could return to operations soon after the first of the year. So that's one thing we're excited about and we're looking forward to. And certainly anything we can talk about on a forward-looking basis and have for ourselves as an organization or our community to look forward to is a great thing for us to be doing right now. So in the meantime, we're here to help with the community, to serve it in any way that we can. Keep an eye on our website because we've got programs coming up all the time for folks who are interested in maybe hearing chatbacks with Broadway stars, seeing what's happening at in other arts organizations across the country. And I guess in closing, the thing I would say that I've been so impressed by, as the world goes through this whole process, we see how important the arts are, because it's the thing we've been leaning on in a virtual environment as we all try to get through this. Artists have really stepped up to the plate. I mean, you can see Josh Groban singing in his shower, for gosh sakes. So we never thought we'd see that. Maybe that's a benefit, maybe it's not. But artists have really been stepping up around the world and across this country to help everybody get through this. So we know there's going to be an appetite for it when we get to the other side. We look forward to welcoming everybody back. Any way that we can help in the meantime, we're there for the community. So thanks for having us be a part of this, Juliet. And again, thanks for everything you're doing at the Alliance.
Absolutely. Well, thank you so much for that. Well, this is our first. We had our virtual hard hat tour of the Parker Playhouse. Thank you for those photos and really appreciate seeing that. Congratulations on that. You know, we all value the arts, but I think we have a newer, a deeper appreciation when you threw numbers behind it. You know, $1.5 to $2 billion impact, 30,000 jobs, that's significant. So we look forward to that, you know, getting back on track, and I look forward to seeing you, my friend, in front of the RNA. Thank you so much.
Yeah, me too. Take care.
So we are getting close to the end of our time. Actually, we're just there. But we I'd like to thank Kelly and all the rest of our presenters for your time here today and all that you have shared. Your information, your insight and guidance has been really helpful to each and every one of us participating. And we thank you for what you're doing in our communities through this challenging times. To close, I'd like to call on Bob Swindell, President and CEO of the Greater Fort Lauderdale Alliance. Thanks, Bob. Take us out.
Thank you, Madam Chair. I appreciate again all your time, and we talked about the press conferences that Mayor Holness has had, and your time commitment to the Alliance increased dramatically, probably you anticipated. But my thanks to you and the officers and the Alliance Board and the participants on the call today, the Zoom meeting today. It's as Kelly said, the relevance of the information is evidenced by the people that participate. And to Kelly's point, you know, part of what makes Greater Fort Lauderdale an attraction for businesses that want to relocate and come to a new community is our arts and culture, and the Performing Arts Center is definitely our crown jewel. And it's great to hear that Kelly and his team are starting to think about, you know, what's next. You know, there's, as Gino touched on, there's a lot of science that's evolving around this novel virus, and as we're learning more and expanding our ability to test and just be able to quantify its impact on our community, businesses are adopting and following, you know, best case guidelines for how to make people safe, and you're hearing more and more about that. I think Governor DeSantis released his task force report last night. When he was asked about excluding South Florida, I think he said a lot when he really complimented our county administrator, Bertha Henry, and our mayor, Dale Holness, as being more than capable of managing Broward County as it exits out of this these guidelines with our county partners to the north and to the south. I think he pretty much said, this is not because I have a lack of confidence, it's because I have total confidence in the quality of the leadership in the 3 southern urban counties. So that says volumes about the leadership that we've got at the local level. He also talked about taking measured small steps, deliberate but important, as we reopen our public spaces. And I'm really proud and impressed with the amount of adoption I'm seeing the local public and businesses and adopting the guidelines and taking them seriously and doing their part to keep people safe. It was great to see Broward County's announcement today and their daily updates. It was called Signs of Normalcy, and it was just some reports out on our parks. Our parks reopened on Wednesday, and it was just giving some snapshots of our residents using the parks. And again, vast majority of folks following the guidelines, making sure that that as they return to using our public spaces, that we're doing that responsibly. So it was great that they called the announcement today Signs of Normalcy, and I think that's very true. Business is on the same path. I think we're hearing more and more from our restaurants as they prepare to reopen and taking those safety protocols very seriously. I'll close with this. We've talked about it before. Our team is working with our partners across Broward County on our I Love Local 2020 campaign. Again, it's our thought to do a 90-day economic stimulus program where we focus on live local, buy local, eat local, and really utilize our local businesses and start restoring confidence in the patrons and customers to go out and fuel our economy with that local drive market that Stacy referenced. I think it's really important, and we want to get folks out and about and feeling confident about that. So more to come on that. Joe Hovanchak on our team has done a great job in leading that effort, and we look forward to sharing it with the Broward community. But Juliet, thanks again, and another great call.
Thank you. Thank you, Bob. Well, thank you everyone for joining us today, and we look forward to seeing you next week. Until then, take care and stay healthy.